Okay.
All right. I'm Ashley Sanders, and I'm going to talk about mental health service delivery in Morgan County, Illinois. My vision is that all Morgan County residents would have the ability to receive treatment for mental health illnesses and disorders before and during a preventable crisis. My needs assessment. Morgan County has lost many jobs in the past 10 years with the closing of factories such as AC Humco and EMI. And this has resulted in many of our residents becoming unemployed and receiving unemployment benefits, using those benefits completely and being left without income or any ways to provide for their families. This has caused an increase in Jacksonville residents seeking treatment for depression and other mental health illnesses and disorders. Morgan County does not currently have a psychiatrist available for mental health treatment for uninsured adults and children. MHCCI, which is Morgan Mental Health Centers of Central Illinois, primarily offers services to Medicaid and Medicare recipients, resulting in the inability of many to receive treatment. So if you have really good health insurance, you can go to Springfield, that's the assumption, but with our busy lives, many people don't. So because Jacksonville does not have a psychiatrist available, a lot of people forgo getting treatment for their mental health illnesses. Passavant Area Hospital does not currently offer any psychiatric services. They don't have a mental health professional working for their staff, Strategic plan is to develop a tele-psychiatric program at Passavant Area Hospital to provide patients with evaluation and treatment while in crisis. Telepsychic is really similar to Skype. It's a live chat with a mental health professional on a computer monitor. At Passavant, they have a mental health safe room, and the person just sits in there all day waiting to be transferred to another hospital to receive treatment. With Telepsych, they'd be able to get evaluated and receive some type of therapy while they're waiting to be transferred for treatment at another hospital. Passavant Area Hospital should also contract with a mental health specialist to provide evaluation and treatment at their free clinic. They have a free clinic on Monday nights, and they do not have a mental health specialist there. By providing a mental health specialist at their free clinic, they would be allowing people to receive treatment prior to going into crisis for a mental health problem. How we would evaluate the success or failure of these programs is that we would analyze the changes in psychiatric patients seeking services at Passavant Area Hospital's emergency room. Currently, there are many people that go there seeking treatment because they cannot get into a psychiatrist. And these people are just going without treatment, sitting in a room waiting to be transferred. And this can take hours or it could take days. Passavant should also track patient recidivism and request patient feedback regarding the new programs. Currently, there's many patients who come to the hospital, go to the emergency room, seek treatment for their mental health illness, and they go to another hospital, they receive their treatment, and then a few weeks later, they're back in the emergency room seeking treatment again. So by providing counseling services and such at the free clinic, this could help to slow down the recidivism rate and lower it. And by requesting patient feedback regarding the new programs, you could be able to tell if patients are happy with the new offerings that the hospital has, or if they just don't really think they're working. My SWOT analysis. The strengths of the hospital. They have an active volunteer base, they have effective annual fundraisers, they have very caring and loving employees, and they have open communication with other hospitals. The weaknesses is the administrative resistance. They don't like change. There's limited psychiatric safe rooms. There's only one psychiatric safe room available in the emergency room, and it's usually occupied. And whenever you have multiple patients seeking psychiatric services and don't have anywhere to place them, that can be a major problem, because then you have to have someone sitting there and watching them, and it's a very dangerous occurrence. Okay. Inaccurate patient data collection. Whenever people are admitted at Passavant, they're not always admitted for mental health illnesses, if that's what they're there for. They could be admitted for a chest pain or arm pain, foot injury, something like that. So a lot of times the patient data doesn't reflect the actual number of psychiatric patients that are coming to the hospital. And resistance from other medical professionals. Medical professionals have a lot of pull in hospitals, and if they don't want something to change, they won't let it change. Okay, opportunities. Currently, Passavant is increasing their available space. If you drive out there, they're building and building and building. So that is an opportunity. There's an abundance of local college graduates with Lincoln Land, MacMurray, IC, even all the colleges in Springfield offer many, many graduates. Telepsych programs. We live in a technologically advanced world, so we should take advantage of those opportunities. Whenever I was researching telepsych, it's actually used throughout Canada. In Canada, there's a lot of isolated towns, isolated communities, and they use telepsych all the time there to provide mental health treatment to Canadian residents. Okay. There's also an increasing need for psychiatric professionals in our community. With businesses closing, depression is going up, and other mental health disorders are also increasing, and there's an increased need for psychiatric services. Threats. Community resistance to mental health treatment facilities. A lot of people were for JDC. They really liked JDC and how it treated the developmentally disabled. But a lot of people don't want a loony bin in their backyard. So a lot of people are very resistant to mental health treatment facilities. There's a lack of psychiatric professionals in our community, and there's also limited psychiatric bed space at other hospitals with psychiatric treatment options. It's very hard to transfer someone to a hospital that has psychiatric beds because they have their own patients that they have to serve first. Okay, my timeline. January 2013, invite psychiatric professionals to discuss treatment options and the need for better access to psychiatric treatment beds at other hospitals. At this meeting, we would also discuss treatment alternatives, and we would talk to other professionals who have used telepsych and how they think it works and how well it works. February 2013, contract with a psychiatric professional to be available on Monday nights at the hospital's free clinic. We would probably have to contract with a professional from Springfield or another large community. March 2013, contract with installers for the installation of telepsych program equipment. For telepsych to work efficiently, effectively, you would have to install broadband internet in the emergency room. Currently, the emergency rooms don't have internet access. You would also have to install computers and monitors and all that fun stuff. Also in March, we would contract with the telepartner service to provide telepsych evaluations, therapy, and treatment for patients. There's many businesses that offer telepsych. They contract with psychiatrists and mental health professionals, and they have a monthly fee, but it's not very bad at all. And they would get the psychiatrist or mental health professional to do the telepsych with. April 2013, install and test all telepsych equipment. You'd want to make sure it works. Hire a full-time IT specialist to monitor connections for telepsych programs. We'd want to make sure that the telepsych program is working all the time, because crisis does not know a 9-to-5 schedule. So, May 2013, launch the telepsych program. November 2013, evaluate the success or failure of using telepsych for patient treatment. And in December 2013, evaluate the success or failure of the free clinic's contracted psych specialist. My budget, $5,000 would be the cost for installation of broadband internet, cables, and computer monitors and software in emergency room 11 and in one outpatient treatment room. $50,000 would be the yearly salary of a full-time IT specialist, and $25,000 would be the contracted psychiatric professional for a Monday clinic. This would be a negotiable salary. And so for the first year, it would cost a total of $80,000. The second year and the third year, you wouldn't have to pay for the installation of the Telepsyc software or hardware. So you would just have to pay the yearly salary of full-time IT specialist and the contracted psychiatric professional. So it would be $75,000 for year 2 and for year 3. And in conclusion, like physical health, mental health is a necessity for every human being. Mental health treatment should not be limited to cities, and providing treatment options in smaller communities will provide those residents with better overall health and well-being. Any questions? Yes.
So the telepsych is going to be available, would be every day, and then you would, on Mondays you mentioned then just having a psychiatrist available?
Telepsyc would be available. The idea for the telepsych is that it would be available in the emergency room. So for people who are in crisis, they would be able to be evaluated and receive some type of therapy and treatment while they're in crisis. And then on Monday nights, there's a free clinic. So people who are feeling depressed or who need to receive treatment for schizophrenia or bipolar disorder or whatever disorder they may have or whatever mental illness they may have would be able to go to the free clinic on Monday nights and talk to a mental health specialist and receive treatment, medical scripts, whatever they may need. So that would allow them to prevent going into crisis. And it would also allow people who have previously been in crisis to receive treatment after their crisis has been taken care of.
Would that eventually lead to somebody being on staff every day?
Hopefully. But currently, the administration does not like that idea. But hopefully, someday it would. Any other questions?
So if there's a lack of psychiatrists in the area, as well as those who would be willing to see the uninsured population, do you think your proposed contract would entice someone to want to also participate in this? Or do you think it would be difficult to find a psychiatrist to participate in this as well?
I think in Jacksonville it would be difficult, but by seeking a psychiatrist or a mental health professional in another community, they may be willing to. It might entice them to. And I think $25,000 a year for 1 day a week is pretty good. So.
Thank you.